Coronavirus Task Force and chair of the Metropolitan Board of Health. Also here will be Dr. James Hildreth, President and CEO of Meharry Medical College, and Karen Golden, nurse practitioner with the Lloyd C. Elam Mental Health Center at Meharry Medical College. And Karen joins us. She has been on the line with testing the assessment center since the very beginning. Also here to help answer your questions will be Director Chief William Swan of the Office of Emergency Management in Nashville Fire Department, and Dr. Gil Wright, Interim Director of Health for the Metro Public Health Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville. I'd like to start with an update on the vaccine rollout and follow that by a discussion of today's COVID metrics, and then an update on recovery efforts on 2nd Avenue. Now, contrary to what the public may have been led to believe during the past administration, we've recently learned that there are no national vaccine stockpiles. There had been a report that half of all manufactured vaccines were being held back in reserve. This turned out to be false. And without this reserve, there will not be a sudden surge in vaccine distribution, and cities like Nashville will not be able to advance more rapidly on our immunization timelines. We need more doses for Nashvillians as quickly as possible. This is our #1 tool for rebound and recovery. Now, as of this morning, the state of Tennessee has received 574,000 total doses from the federal government. And as of January the 19th, all providers across Davidson County have received and administered 64,194 total doses of the vaccine. Now, that includes a little over 18,000 second doses to qualified residents and workers in our jurisdiction. Now, of that total, our hospital and nursing home partners have administered a little over 54,000 doses. And to date, Metro Public Health has administered just under 10,000 doses. Now, Phase 1A has 75,000 recipients in Davidson County, and our 75 and older population is 34,000. So we're about halfway through our first phase goal. Now, by mid-February, we expect to be vaccinating Nashvillians in Phase 1B, and that includes teachers and child care workers, and that's approximately 25,000 more people. Now, with more vaccine, we can speed up this timeline. Now, in Davidson County, 13.4% of our 75 and older residents have started their 2-dose series. And over the next week, Metro and our hospital and health partners expect to administer 5,400 doses of COVID vaccine in Nashville. Now, this is an average, it's a lot of math here, but this is an average of of 750 doses per day, using all the vaccine that we have with nothing left over. But Nashville has a total population of over 700,000. Now, with our healthcare partners, we have the capacity to vaccinate 4 or 5 times more people every day, safely, without wait times and long lines. But in order to do that, we need more vaccine. We received our latest allotment of first doses this morning, and we will receive an allotment of second doses tomorrow morning. We did not let any go to waste. And since our last update, more than 3,000 additional Nashville 75 and older residents have received the vaccine through Metro Public Health, Meharry's new weekend clinic, and Vanderbilt's distribution to its established patients. Now, public health staff began calling through hundreds of names on the current 75 and older waiting list. And this past weekend, 194 residents on the 75 and over waiting list who had not already received the vaccine through a healthcare provider were vaccinated by the health department. The health department plans to vaccinate 100 to 150 more people on the waiting list daily as vaccine supplies allow. Seniors will continue to receive vaccinations by appointment every weekend through January and beyond, as Metro receives more vaccine. Now, to be added to the 75 and over waiting list, visit covid19.nashville.gov. You can also call 615-862-7777 between 7 a.m. and 7 p.m. And once you register, you do not need to register again. Your name will remain on the waiting list until you receive your vaccination. Now, this morning, it's my pleasure, as always, to welcome Dr. James Hildreth of Meharry, who's here to talk about the vaccine. And I also want to welcome Karen Golden, a family nurse practitioner at Meharry Medical College. Karen is a frontline healthcare professional who's worked at Metro's community assessment centers. She has been vaccinated and is here to discuss the importance of choosing immunization when your turn comes. And now a report on the level of disease in Nashville. Today we're reporting 478 new daily cases, with a 7-day average of 72 new cases per 100,000 residents. This is a significant drop from Nashville's record high on January the 4th of 109.5 per 100,000 people. Our 7-day positivity rate is 13.8%, a 4% improvement over last week's rate. Now, counties without mask mandates and other public health protocols in place are seeing positivity rates as high as 29%. Now, finally, our transmission rate has reached 0.9, which is below our target rate of 1. This indicates the rate of coronavirus spread is declining. Now, we're still in a community spread condition and are still enforcing our public health orders. This past weekend, Public Health issued 3 civil warrants for businesses that were operating out of order. Enforcement of our rules will remain in effect during this time of elevated infection rates. Now, a study released on Tuesday by The Lancet, a distinguished medical journal, of more than 300,000 people in the U.S. presented even more evidence that masks work. For each 10% increase in mask wearing, a community's odds of keeping the transmission rate below 1, that's our public health goal for that metric, the success of that increases by 3.5 times. And we're seeing this bear out in Nashville. In contrast, other cities and counties where mask wearing is not required or enforced have higher numbers. This week, the United States passed the solemn milestone of 400,000 COVID deaths. And notably, Nashville's case fatality rate is less than half the national average. It's clear the steps that we've taken in Nashville have saved lives, but our work is not over. Wear your masks, observe social distancing, avoid gatherings, and let's stay healthy. Now, tomorrow morning, I will convene a virtual meeting with the historic downtown community, the first of a process. And since the Christmas Day blast, Nashville has wrapped its arms around this historic place and the people who bring it to life. We will rebuild historic 2nd Avenue better and stronger, and we will do it together. The process will be inclusive and transparent. We'll leverage the best minds and talent in disaster recovery and historic preservation, both locally and nationally. And we're going to listen to all Nashvillians who want to have a voice in this process. What happened on Christmas Day was a tragedy, and now we're going to turn tragedy into opportunity as we rebuild 2nd Avenue in a way that honors its history and better connects it to the rest of our city. Now, as a reminder, anyone who lived or worked in the affected area can apply for federal relief funds through Catholic Charities at NashvilleStrong2021.org. Now, I'm pleased to introduce our heroes of the week, the COVID-19 Hands-on Nashville volunteers. Throughout the pandemic, more than 900 individuals have volunteered, many of them multiple times, for a total of more than 4,900 hours at our community assessment centers. And 330 volunteers have worked more than 1,900 hours at Metro's vaccination sites. Nashville's COVID response could not be possible without their dedication to community service. I'm grateful to all the Hands-on Nashville volunteers and encourage everyone to visit HON.org to consider donating some of your time as you are able. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 5,541 active cases. This is so much better than our peak just 10 days ago, which was 8,531. The total number of new cases is 478 for a total of 81,141 cases since this pandemic started here in Nashville. Our rolling 14-day average is 586, which is lower than it was last week. And our 7-day average for cases per 100,000 is 72. Another good note is our 7-day positivity rate has dropped to 13.8%, down from 17.8% just last week. And our transmission rate is down to 0.9%. And we still continue to test strongly here in Nashville with over 866,000 tests being administered since this pandemic began. Our hospitalization numbers have also greatly improved from last time. Middle Tennessee now has 795 people admitted, down from 943. And Davidson County has 483 individuals admitted compared to 572 people just last week. But still, 547 Nashvillians have died because of this pandemic. Now on to the vaccine. Davidson County continues to be in phase 1A2, as well as those 75 years and older. Now, phase 1A2 includes healthcare workers, long-term care residents, first responders, mortuary workers, and again, 75 and older. So far, close to 33,000 Nashvillians have received a first dose. This means that close to 5% of our population has started a vaccination process. And of these, more than 10,000 have received their second dose, bringing them a step closer to full immunity. Now, we'll continue to administer vaccines as quickly as we get them. When we get new doses, we plan to get them out within the week that we receive them. Getting more vaccines is the single limiting factor on how quickly we can vaccinate our city and move through our phases. We continue to work with the state to get the vaccine supply that we need. Now, an update on our community assessment centers. The hours now are 10 a.m. to 3 p.m., Monday through Friday. If we get a cold day, we'll adjust the hours in order to keep the safety of our staff and our patients. So watch out each day for updates on social media. Now look, our numbers are very encouraging, more encouraging than they have been in a long time. The transmission rate is down, the 7-day positivity rate is down, and the hospitalization numbers are down. This is really good momentum, and I just want us to keep the momentum going. So do what you already know how to do. Stay apart, wear a mask when you're in public, wash your hands. If you're worried about being exposed, get tested. And if you test positive, look into getting monoclonal antibody therapy. This may save your life. And finally, when it's your turn, get your shot. Get the vaccine, encourage others to do so. It's the biggest thing you can do to win this fight. Thank you, and I turn it over to Dr. Hildreth.
Good morning, Nashville. It's very gratifying to see millions of Americans, including hundreds of thousands of Tennesseans, receiving a safe, effective COVID-19 vaccine. This provides real hope that we can bring an end to the pandemic. But there is still the dual challenges of dealing with high levels of community spread of COVID-19 and the hesitancy on part of many of us to accept the COVID-19 vaccines. One of the main concerns I hear repeatedly is how can these two vaccines be safe when they were developed so rapidly? And it needs to be understood that none of the steps that are required to develop a vaccine that's safe and effective were omitted for these two vaccines. There are several factors that contributed to the speed, but there are three in particular I'd like to bring to your attention. First of all, there are some incredible technologies that were brought to bear on developing these vaccines, that weren't available just a few years ago. And I'll just give you one example. The genome for the SARS-CoV-2 virus was published on January the 10th. Less than a month later, at least two companies that I know of had already identified a vaccine candidate. That process in the past could take as long as 2 years, sometimes longer than 2 years. So a process that took 2 years because of technologies was compressed to 1 month. The second thing is vaccine development is usually an iterative process. There are sequential steps and phases that are followed. None of those steps were omitted in the case of these vaccines. What was done is that these steps were run in parallel. So by having parallel processes as opposed to sequential, that also compressed the timeline. The third thing is that over the last 3 decades, a global, robust infrastructure for developing an HIV vaccine has been developed, has come into being. So what has happened is those scientists, those facilities, and those technologies were asked to pause and focus on COVID-19. So the HIV infrastructure for vaccines was dedicated to COVID-19 vaccines. And these 3 factors largely contributed to the fact that in the span of 10 months, 2 vaccines were developed that are safe and effective. The other thing that I hear quite often is that people do not want to be guinea pigs for the COVID-19 vaccines. Consider this, that 70,000 people in total participated in the trials for developing these vaccines. And as of today, 50 million doses, at least 50 million doses have been given worldwide, including 18 million doses here in the United States. So in no way should anyone consider themselves to be guinea pigs for these vaccines. Let me just give you a couple of thoughts about the vaccine trials themselves. These trials were large, and as I said, between Moderna and Pfizer, more than 70,000 people participated. They included large numbers of people who are older than 65 years of age. They included large numbers of folks with high blood pressure, heart disease, chronic lung disease, and obesity. And more than 30% of the participants were ethnic and racial minorities. This is very important because these groups of individuals are most vulnerable to disease and death. So I think the drug companies did a great job of enrolling participants. The last thing is that for vaccines that have been developed in the past, usually if you're going to see a severe reaction of any kind, they would occur within 6 weeks of giving the vaccine or injecting the vaccine. That is why the FDA required a minimum of 2 months of observation before they would even consider emergency approval of these 2 vaccines. And they were well tolerated, and most of the side effects that people experienced, which some of you have already experienced, are those you expect to happen when your immune system becomes activated. For example, when your immune system becomes activated, we often develop fevers. The lymph nodes closest to the site of injection might swell, so you might get swelling under your arm. We refer to that as lymphadenopathy. These are all things that happen, or expected to happen, when your immune system becomes activated. And please note that some of you, the second reaction will be much more robust than the first, because you're going to be induced a secondary immune response, which can be 1,000-fold stronger than the primary response after the first dose. So don't be surprised if after the second dose of the injection, you have a more robust response. So these vaccines are very safe and effective. They've been subjected to a rigorous evaluation spanning several months. And as I said, more than 70,000 people were part of those studies. I'm encouraged that the vaccines should be given to everyone who's willing to accept them. And for those of you who are hesitant because you don't think they're safe, I can assure you that they are. And that is why I myself have taken one of these vaccines, and I've encouraged my family members, all of them, to get them as soon as they become available. So Nashville is still going to be many months before we get the level of vaccination in the population we need to get to. And there's a lot of virus out there, so we still need to do the things that we've been doing to keep the virus in check. We all know what those are: wearing masks, keeping our distance, and one thing that's really important is to avoid crowds. That's especially important now that we know there are variants of the virus that may be more transmissible than the previous ones. The good news is that the same things we've been doing to mitigate the original strains of the virus, they will work just fine for the variants. So let's keep doing what we're doing. And Nashville, as always, we've got this, but we got to do it together. And with that, I'd like to introduce Karen Golden, who's a nurse practitioner at Meharry's Elam Center. And let me just say, as president of Meharry Medical College, it's been an extreme point of pride for me to watch how the Meharry team has managed the assessment centers and the vaccination centers. They have exemplified the kind of mission that we have, which is to be kind, respectful of people, and do all the things that we need to do to make people feel comfortable and I'm so proud of all that they've done. With that, I'd like to introduce Karen Golden. Thank you, Nashville.
Thank you, Dr. Hildreth. Good morning, Nashville. My name is Karen Golden. I'm a nurse practitioner at Meharry Medical College, and I work under the leadership of Dr. Hildreth, who just finished speaking. I am a nurse practitioner, and I have been volunteering down at the COVID testing site since it started. I come to you not only as a frontline worker who have volunteered and who have actually taken the vaccine for myself, but I also come to you as a daughter who would love to be able to go home and to be able to hug my elderly father who's 80 years old. I would love to be able to see my granddaughter stop bouncing off the wall so she can be able to go back to school. So for those of you who still have questions about the COVID vaccine itself, I encourage you to educate yourself, first of all, by contacting your primary care doctor or calling the local health department. Educate yourself with resourceful information and not just rely on social media. So I encourage you to do that. And once you educate yourself, I encourage you to take action, and hopefully you would take the action to make the decision to take the vaccine, the COVID vaccine. Not only just take it for yourself, but also take it for our children to get them back into school, to also do it for our elderly, to get them from behind the glass wall so we can be reunited with them. And so as we continue to take the vaccines, I encourage you, like all of others have said, let's continue to social distance and wear our mask and wash our hands and avoid large crowds. Thank you.
Thank you, Karen. We'll start with media questions now, starting with Nate Rao. Good morning, Nate.
Good morning. My question is for Mayor Cooper. Mayor, do you have an opinion about the legislation that was filed this week that would take state education funds away from Nnps if it doesn't offer in-person instruction a certain number of days this year?
A way to get that through email or on WebEx, sorry. Type in your question on WebEx, if you will, please. Nate, while you're writing your question, we'll go ahead and go to our next question from Tosin Fakili at Channel 4. Tosin, are you there?
Good morning. I am. Can you hear me? I'm here. Can you hear me?
Do the same thing over WebEx to type in your question, please. I'll do it so they can hear on the. So Nate, thank you for writing those in. I'll go ahead and read your question now. This is to Mayor Cooper. Does Mayor Cooper have an opinion about state legislation filed to take BEP funds away from MNPS if it doesn't offer in-person instruction?
Well, thank you, Nate, for the question. Just for those as I heard it, is my general reaction to the legislation, saying it's going to withhold funding for schools based on a reopening schedule. My reaction is that I get the frustration and even the intention. We all want our kids back in the classroom, but a bill in the legislature won't cancel the epidemic. And you can't tap your toes and make the reality of this virus disappear. You have to be realistic and not just react with understandable frustration to the situation, but let's follow the science and do the hard work and get us reopened as safely and as quickly as we can. So let's mask up statewide, let's get vaccines out, reduce community spread, and make it safe for kids and teachers to re-enter the classroom. And let's not punish children by threatening to defund schools. Let's keep them safe and invest in them. And we need to respect and support teachers in Tennessee. And it's a heck of a time to threaten resources, the resources that we're going to need to help students make a full academic comeback, which has to be our highest priority. But so help us, I kind of want to say to the state, help us reopen by getting us vaccine more quickly. And let's do that and work together and get out of a culture of division and get to one of unity and get on with our shared purpose. Thank you, Nate.
Our next question is, and this is the last question we have for today, is from Tosin Fakili. She's asking Mayor Cooper, when did you find out that the last administration lied about the vaccine stockpile? And what does this mean for vaccinations in Metro? Should we expect a slowdown or delays?
Well, thank you. Over to Dr. Alex, who is in daily consultation about the amount of vaccines. Part of this is, I think, just general publicity, and I go home and look at the news stories and say to Alex and our health department, what about all this vaccine that people seem to be talking about? And let me ask him to share his answer with you.
Sure. So I think that the challenge is this. So for the past month or more, not just Metro, but I think the state has been told, hey, stock vaccines. Get you have out. For every vaccine you give out, there's this second group of vaccines that will come, and there won't be any delay. Obviously, that doesn't hand out. The state is giving out what they can to us, and ends up part of the reason the state hasn't been able to give us as much as they thought they were going to be able to give us is because there's been no rollout. The Biden administration mentioned that just yesterday, and that's, I think, when we all have realized this. Now, with that said, we have a commitment from the state of getting at least 5,400 vaccines a week, new doses. So new doses plus whatever doses we have to give as second doses. So right now we have a commitment to getting several thousand vaccines a week. But still, 5,400 in a city of 700,000 is we can do better. All right, we can do better as a state. We can do better as a country. I tell you, but as a city, if we get more, we have the operations, just like we did with our assessment centers, to put those vaccines in arms. We don't sit on vaccines. And so give us more vaccines. I assure you, with both what we do at Metropolitan Health, partnerships with Meharry, partnerships with Vanderbilt, and other systems, we will get vaccines in arms. So my hope is that the state's commitment of at least 5,400 a week will continue. At least that gives us some, but we need more. We have a way of getting them in arms. And hopefully the Biden administration will help us as a country, and we'll give them to the state, and the state will give them to us. So thank you.
So those are all the questions we have this morning. I'd like to thank Karen Golden for joining us today. And as always, we're grateful to Amy Lankite and our partners at the Bridges for Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next COVID press briefing will air on Thursday, January 28th at 9:30 a.m. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.